to this episode of CQC Connect. My name is Sam Wallace, Provider Engagement Lead here at the CQC. In May, CQC launched our new strategy, and this is the latest episode in a series where we're exploring the ways we are starting to implement our ambitions and transform how we work. I'm joined by three guests today who are going to talk about work we are doing to develop how we use people's experiences of care in our regulatory model. I'll hand over to my guests now to introduce themselves. Jill, can I start with you?
Hi, I'm Jill Morell, Head of Public Engagement at CQC.
Great, thanks Jill. And Dave?
Hi, I'm Dave James. I'm Head of Adult Social Care Policy at CQC, and I've been leading the work on our cross-sector assessment framework.
Thanks Dave. And Kat?
Hi there, my name is Kat Olausson. I'm a qualitative development manager in the analysis team in intelligence.
Great, and thanks all for joining us for today's episode. Jill, if I can start with you, and it'd be great if you could set the scene for us a bit and give some background on what we are looking at in this area of our work and why it's so important for CQC.
So we all work at CQC because we want to improve care for people. That's what gets us out of bed in the morning. And we rightly say that people are at the centre of what we do. And our new strategy really reflects that. We say we have a very clear ambition to have regulation driven by people's needs and experiences. So what we're trying to do in the work to take this forward is really get underneath that and make that statement into a tangible reality. So we make the best use of the experiences that people take the time to share with us about their care. And why are people's experiences important? Well, they're an incredibly valuable source of intelligence we can use for multiple purposes. There are people in every service that we regulate. You could argue that a person's lived experience is the result of a combination of systems, policies, clinical procedures, staffing, leadership, all of the things that are so important for CQC to understand. People live in systems as well and experience multiple services and the gaps that we know sometimes exist between them. So what we are working on to try to make that a tangible reality is, firstly, if people take the time to share experiences with us, we want to make the most of them. And Kat will talk a little bit more about that later. Secondly, we want to be really clear and consistent in how we use people's experiences. So we've got a shared understanding of their value and how they are practically used in our work. We're working on a definition of what people's experiences really mean so that we've got that shared understanding. And we're developing some principles for how we use people's experiences and a framework for how we enact those principles in each part of our regulatory activity and decision making. Thirdly, we all recognise that we need to hear more about people's experiences and from a wider range of people. There are many areas to explore here and we want to test them so that we understand the best sources. And as part of that, in the new assessment framework that Dave will talk about, we want to consider increasing our scrutiny of how providers and systems listen and act on people's experiences. There are some really good examples of how well that's done out there and how it helps to improve care. And also of critical importance is being able to report back to people on how we've acted on their experiences. We need to be able to do this much better so that we can encourage and incentivize people that it's a thing worth doing. And finally, what we want to do obviously is engage and co-design this internally and externally with people and providers about so that we get this right and because it's in line with our strategy.
Thanks, Jill. That's really helpful, and I think just from hearing some of that background, we can really see how this links in with some of the other work we're doing around our new regulatory model, in particular some of the work around assessment frameworks that we've previously discussed. Dave, can I bring you in now just to kind of maybe say a few words about how this work connects with some of that other work and in the development of our future regulatory model?
Yeah, sure. As Jill said, this is a really important part of our strategy, and our developing assessment framework reflects that probably in three main ways. The first one is how we are using what people have already said they expect from care services and from systems as well, and we're doing that by working with our partners. So we're looking at what's been developed and co-produced by, I think, Local Like Personal and also the National Voices, to look at the I statements that have been produced there. And those are really kind of plain English descriptions of what people say good quality person-centered care looks like to them. And we want to see if they're a helpful way of bringing to life our 5 key questions, as a way of perhaps prompting people to really understand what they should expect from care, whether that's health, social care, or perhaps a combination. As Jill said, this is applying across whole systems, and possibly as a way of kind of spurring people to provide feedback to us and also to the services themselves. So that's the first part of this. The second is that really clear in our framework that people's experience is one of the 6 key evidence categories, alongside observation, feedback from staff and from our partners, and alongside outcomes data and provider records. People's experience is a really key component of how we'll build our judgments and make our assessments. And we'll be really clear against each of our standards and our kind of requirements. Will be really clear when people's experience is an absolute essential, and we'll develop clarity on how much of that we need to be gathering in order to make robust assessments. And then, as Jill said, the third part of this, so far as the assessment framework is concerned, is strengthening the parts of our framework where we're touching on our expectations around what providers and systems do to gather feedback, and that we're actually being much more clear that we expect providers to do that and to do that well, and to learn from that. Sorry, not just providers, the wider system as well. So those are the 3 kind of main areas that the assessment framework links in with this.
Thanks, Dave. And I think kind of just following on from that, then we can definitely see how people's experiences of care are a really key source of intelligence for us in our work. And it'd be interesting to hear a bit more about that, and how we might want to be using it in things like our monitoring work or our assessment work, for example. Kat, can I bring you in there to maybe say a bit about that?
Absolutely, and I'm very excited about what Dave and Jill has just outlined, because I think analysis can really help all of those things to bring alive. It's almost like the engine room in the back that sort of where we calculate and look at interpretation of different experiences and things like that. So I'm excited about it because I think it really offers us that opportunity to really think about what is it that people's experiences bring to our understanding of quality of care. So that might mean to bring positive as well as negative experiences into that understanding. It might mean that we have a very clear view on what type of data, for example, is appropriate in which sort of situations. So, for example, sometimes we rely on, robust survey representative samples, and at other times for other circumstances or for other services, we might look more in depth at certain experiences to really make sure that we are using the data that we hold around people's experiences, and also making sure that we have and collect data around experiences that we might not hear so often about, to really make sure that those more quiet voices are amplified. So I'm really excited about kind of exploring those possibilities, and as Jill mentioned before, really bringing out the value of those experiences to help us make better decisions and ultimately provide better care for people. So another part that I think we want to explore more about, and that we feel quite excited about, is really thinking about people's experiences as a unique way to understand health and social care. So we're really thinking about the differences that exist between different data sources. For example, Google reviews, what can that tell us? What can that bring for us, a sort of up-to-date view of the service, versus other type of data sources as well? And how can we kind of make sure that we use people's experiences, for example, to understand that there is a sign that things are changing as well. So really, really trying to kind of think about all of the aspects that we want to understand as a regulator and how people's experiences can fit into that. And I guess including in that is also about understanding people's needs, what they want from health and social care, and to make sure that we are on top of that and that we're using those sources to really understand what those needs are and how they develop over time.
Great, thanks for that, Kat. And I think one of the other things that really stands out about this work is what it might mean for how we work differently with providers around making sure we've gathered the right experiences from people who use services and hear from as many people as possible. It'd be great to hear a little bit more about that. Jill, can I start with you?
So I think that people that provide care, the services that people receive, they are really keen to be the first point of contact for somebody who wants to feedback about the quality of their care. And we know that the people that provide care services are accountable for listening to that feedback and acting on it. So I think we want to work with providers to make sure that we are really understanding how they're doing that and what it can tell us about the quality of the service that they're providing. So I think we all understand that not everyone feels comfortable feeding back to the people that are providing care to them. So we always need to acknowledge that, and people need to feedback where they feel most comfortable. But the more that a provider of a service can do to make people feel really encouraged and enabled to feed back, the better it is for their service and the better it is for us, because we can gain some assurance from the fact that the service will be a good one if it's listening well to people who use it.
Thanks, Jill. That sounds really interesting. It'd be really interested to hear a bit about how we might be taking this work forward and some of the work we'll be doing to help realise our ambitions in this area.
Yeah, so we're really, really keen to engage with people who use services and with providers and of course with our own staff and other stakeholders about all of the work that I described earlier, alongside the engagement that we're doing on the work that Dave's leading around the assessment framework and our new regulatory model. It all needs to make sense to people, you know, how all this joins up. So we're really keen to do that, particularly at the moment, the work that we're doing on the principles and framework for how we use people's experiences and our thoughts on testing some new ways of hearing from people.
Thanks, Jill. And final question for everyone. It'd be really great to hear what you think could be one or maybe two most important outcomes from this work. So just thinking ahead, what would success look like for us getting this piece of work right? Dave, can I start with you?
I think people just being much more clear on what they can expect and how they should feel empowered and enabled to feedback on that, really. And I'm thinking about my own mum there and her recent experiences, and you know, I think we could have done more in how we set out what people should expect in the public who aren't necessarily a specialized audience. So yeah, demystifying and really encouraging people to share their thoughts with us.
Absolutely, that sounds so important. Kat, how about you?
Yeah, linking into what Dave was just saying there as well about really understanding how people's experiences feed into the decisions that we make and that they can know how that information has been used, and just being really clear about that is something that I'm really looking forward to it, and really being able to tie this sort of analytical element of things together with the better decision making, together with bringing people into the picture and telling us about their care or reusing, you know, things that we hear through a provider, for example. Those are the sort of things that I'm really looking forward to.
Absolutely, and I think that really echoes what we've talked about in the strategy about putting people and communities at the heart of everything we do, doesn't it? Jill, I'll give the kind of the final word to you on that. What's a really important outcome for you?
Well, I think what Dave and Kat have said is really about a culture change in people who use services feeling that it's okay to speak up and to feedback about good experiences and bad. And we know that people sometimes are afraid to do that, or it's not in our, British culture to do that, to speak up. But we really need people to do that so that services can improve. It's a collective endeavour that we're all in here to improve care for people.
Absolutely, that's a really important point to finish on. So thanks all for joining us today. This really does sound like really important and interesting work that's going to be taking place over the next few months. And thanks everyone for listening to this podcast episode. If you'd like to get involved in helping shape this work and other elements of our work implementing our new strategy, then visit our digital engagement platform Citizen Lab, and you can find the link to that in the episode description. There'll be ongoing opportunities to feedback and future updates on this work available there. And for more on how we are implementing our strategy, look out for blogs on our Medium page and videos on our YouTube channel. So thanks again to Jill, Dave and Kat for joining us today, and thanks for listening, and look out for more podcast episodes coming soon.